So if there is a lump in the breast, or it feels like a knot or thickening of the skin, that's something to look out for. Whether there's swelling of the breast, one is more swollen than the other, or if there is any change in shape to the breast, then they should come and get themselves checked. Other symptoms could be a lump in the armpit, or even a lump in the collarbone. Those are things that they should look out for.
And
So we try to kind of
all these tests.
I retired, and obviously, but thankfully,
All right. Welcome back. It's a brand new episode. And with me in the studio is Dr. Taghreed Almahmeed, the Consultant General Surgeon at Zahra Hospital, Dubai. How are you?
I'm very good, thank you. And you?
I'm good. I'm so happy to have you in the studio because, it's the month of October and Pinktober, and everyone's talking about breast cancer and breast cancer awareness. And I feel like even though we have so many programs and so many initiatives in the country, a lot of people are still misinformed. And this is something we were just talking about before we started rolling, is that some people still have a ton of misconceptions when it comes to breast cancer, when it comes to detection, when it comes to treatment as well. And you're the pro, and we're going to ask you all the questions we have in mind. So the one thing that I want to ask before we begin is, how important is it for women to get checked?
Okay, so it's very important for women to get checked and screened for breast cancer starting from the age of 40. So from the age of 40, they should go to see the clinician. The clinician will take a detailed history, including a family history, and then do a physical exam, and then send them down for a mammogram. So the mammogram is basically a X-ray picture of the breast, and it helps us detect any what we call calcifications in the breast, or any small lesions which we as clinicians or even the patient cannot feel.
Okay.
Because the mammograms help us detect any cancer in their early stages before any symptoms are present.
Okay.
So I recommend women from the age of 40 and above to be screened with a mammogram every year. And women below the age of 40, like from the age of 30, they can have breast ultrasounds.
Okay. And a physical examination is also necessary?
Yes, I would also recommend to have yearly physical exams by their clinician. And I really emphasize that they should start breast self-exams from the age of 25. So they get used to the look and the feel of their breast. So if they detect any abnormality, they can go and get it checked right away.
Right away. Okay. And why is it that a lot of women still don't go in for these physical examinations or for the mammograms?
Well, some of them are not informed.
Okay.
Or they're not aware that they should be doing this.
Right.
A lot of women are scared. I find a lot of women are scared to get checked because if they think that they do have something, they don't want to know.
Oh.
Which is not good, because God forbid if they do have something, we need to know early.
Mm-hmm.
We need to catch the cancer early, because then it's easily treatable and less invasive treatment procedures.
Okay.
Yes.
And are there certain misconceptions about mammograms that women, that avoid women from going in and getting them?
Yes. A lot of women say, no, I don't want to do a mammogram because it's very painful.
Really?
Yes. Sometimes it can cause a bit of discomfort, but that's why we advise women to have their mammogram done after their menstrual cycle.
Okay.
And that way it won't be painful. And also they're afraid that the mammogram gives more radiation because it's an X-ray picture. However, the radiation that they're exposed to from the mammogram is way less than what we're exposed to even from the environment. So
Right.
The radiation is very low, and there's no need to be afraid that it will cause breast cancer.
Right.
In fact, we're trying to detect breast cancer early.
Absolutely. And how common is it? How common is breast cancer in the region, globally? Like, are there any statistics that we know of?
Yeah, well, globally, every statistics show that every 1 in 8 women will develop breast cancer. However, in the UAE, the incidence is more than that. So they say that every 1 in 5 women will be diagnosed with breast cancer.
Oh my. Okay. And is there a reason that there's a rise in the number of people being diagnosed with breast cancer?
Well, maybe part of it is the increased awareness, and so we're catching more cancers by early screening. Like, lifestyle factors are very important. Physical exercise is extremely important, and people should try to get into a routine of exercising regularly, maintaining a healthy weight. Food, our foods now are a bit quite unhealthy, like to stay away from processed food, fast foods, fried foods, and try to stick to fruits, vegetables, high fiber diets. Stay away from high calorie drinks like fruit flavored drinks and sodas and low nutritious foods. That is really, really very important.
Okay.
And of course, if people are smoking, they should try to quit smoking, because smoking has been found to be a cause of any cancer and breast cancer.
Absolutely.
And to limit alcohol consumption, if not stop it completely.
Right. And we know that, I mean, for years it's been communicated, like smoking, drinking, healthy lifestyles. Those are the factors that will actually decide whether you go down the path of having a healthy body or not. But I just want to know, like, out of curiosity, is it a vicious type of cancer? I know that certain types of cancer, or depending on where the cancer is, they tend to be more vicious than others. So is breast cancer a vicious cancer?
If we catch the cancer early, in the first stage, then the cure rate from this cancer can be up to 98%.
Wow.
Yes.
Okay.
And that's why we really emphasize the fact that early detection saves lives. And screening is very, very important.
Okay.
But some women may have a family history of breast cancer, or they may have a genetic mutation. Someone in the family may have a genetic mutation.
Right.
And so it's very important for women to know their family history and know if anyone has a genetic mutation in the family, because if they do, they also need to go and get checked.
Right.
Now, as far as vicious, it depends, because cancer depends not only on the size of the lesion, but it also depends on whether it has spread to the neighboring lymph nodes in the armpit or not, or whether it has spread to other body parts.
Right.
And it also depends on the biology of the disease. What I mean by biology is we look at what we call hormone receptors, estrogen and progesterone hormone receptors, and a protein called HER2. Now, that means basically, some cancers are fed by estrogen and progesterone, and we consider those to be the good type of cancers, meaning they are more easily treatable, and after they get treated, they can have a tablet which they take for 5 years or even 10 years, which blocks the estrogen in the body.
Okay.
So those tend to be milder. However, if there are cancers that are not being fed by estrogen, then those which we typically call triple negative cancers, so estrogen, progesterone, and HER2 are negative, then those patients typically need chemotherapy.
Okay. And what are some of the symptoms that people should look out for? If they feel like something's up, or what are some of the symptoms related to breast cancer specifically, and then maybe other types of cancers?
Right. So by doing, like I said, a breast self-exam every month after the menstrual period, like the woman should set a specific date after the menstrual period, and examine her breast so she gets used to the look and feel. So if there is a lump in the breast, or it feels like a knot or thickening of the skin, that's something to look out for. Mm-hmm. Whether there's swelling of the breast, one is more swollen than the other, or if there is any change in shape to the breast, then they should come and get themselves checked. Other symptoms could be a lump in the armpit, or even a lump in the collarbone. those are things that they should look out for. And also redness of the breast or warmth or any skin dimpling or puckering. Sometimes if it's an advanced cancer, it gives like an orange peel appearance.
Oh, wow.
And that
Okay.
means that it's quite advanced.
Okay.
So, and then there are nipple changes. So if the nipple suddenly gets inverted inwards or retracted inwards, or it changes its shape, or if there's any nipple discharge, especially if it's bloody nipple discharge or clear nipple discharge, that's also something to look out for. And sometimes there could be other nipple changes like dryness of the nipple or scaliness or crustiness of the nipple. These are also symptoms to look out for.
Okay, wow. This is mind-blowing because I don't think I've ever heard of these symptoms, like the visible and the discharge symptoms. I've never heard of that before. So as a person who wants to self-examine, like how should women do that? I mean, there is a way to do it, right? Or is there a sequence that you should follow when you're checking for knots or lumps in the breast?
Right. So like I said, they should do it after the menstrual cycle.
Right.
And if they're in menopause, they should just choose one day in the month and then repeat it every day of that, of the next month.
Okay.
That same day.
Okay.
And so basically, they should use the pads of their fingers, not the tips, the four fingers like this, and then just go around in circular movements around the breast and in the armpit, and they should raise their arm and go around in circles to feel if there's anything abnormal. They can do it in the shower, they can do it while lying down, or they can even do it while standing in the mirror.
Okay, that's amazing. I like that. That was very clear. So then let's say a woman, finds a mass. I mean, she does the self-examination at home and she finds a knot or a mass. What's the next step? Go visit a physician, but then what happens next?
Okay, so the physician obviously will take a history, do a physical exam, and then we'll start to do some imaging studies. So if the woman is 40 years old and above, we'll start with a mammogram. If she's 40 years or below 40 years, we'll do an ultrasound of the breasts.
Okay.
Now, I just want to point out that not all lumps are cancerous. There are many lumps in the breast that are very benign. They could be cysts, which just have clear fluid in them and they're not worrisome at all. They could be solid lumps, which are known as fibroadenomas, and most of them are actually benign. Mm-hmm. So most lumps in the breast are actually benign.
Okay.
They're not cancerous. But again, there are the cancerous lumps as well. So if they're below 40 and something is noticed on the ultrasound, we can then go on to do a mammogram or an MRI of the breasts. And same with those above 40. Ultrasound and MRI of the breasts.
Okay. And how different is the treatment plan in all the different stages? So, can you walk us through, the stages of breast cancer and how the treatment plan differs from one stage to the other?
Okay, so there are 4 stages of breast cancer. There's stage 0, and then it goes up to stage 4. Stage 4 means it's metastatic. It means it has spread in the body, either to the liver, the lungs, the brain, the bone.
Okay.
That stage 4, usually we don't operate on them. We give them systemic therapy in the terms of chemotherapy, immunotherapy, targeted therapy, or hormonal therapy.
Okay.
Now, stage 0, we call it ductal carcinoma in situ, which means that the cancer cells are still in the milk ducts or in the milk lobules. They haven't gone beyond the ducts into the breast, meaning they haven't spread yet. So that's the earliest stage of breast cancer.
Okay.
So it depends. If it's just in one area, the patient can have a lumpectomy, which is removing that area. And that should be followed with breast radiation.
Okay.
Or if it's all over the breast, then they tend to have a mastectomy.
Okay.
So again, now back to the stages. So stage 1 means that the lump is less than 2 centimeters in size and it hasn't spread to the lymph nodes in the armpit. Stage 2, the lump is usually between 2 to 5 centimeters and there could be 1 to 3 lymph nodes positive in the armpit.
Okay.
Stage 3, the lump is usually more than 5 centimeters, and there are more nodes that are in the armpit, like 4 to 9 lymph nodes.
Okay.
Or we have a type of cancer called inflammatory breast cancer, where there is redness of the breast and thickening and swelling, and that's also considered a stage 3 breast cancer.
Okay.
So as far as treatment is concerned, well, studies have shown that there is no difference in the long-term outcome or survival or recurrence of the breast cancer whether the patient chooses to remove just the lump itself or to remove the whole breast. Typically, when they remove the lump itself, then it has to be followed by radiation post-operatively, which is usually a month after surgery. They have to have radiation, and that is to prevent recurrence. Most patients, if they opt for a mastectomy, then they don't need radiation, but some do. Again, it depends on the size of the tumor, the biology, and how far it's spread.
Right. I'm glad you mentioned that, because my next point was going to be about reconstructive surgery and how effective is it, and can all women who've had mastectomies actually opt for it, or is it certain cases, and how beneficial is it? I mean, psychologically as well, because I feel like a lot of women opt for it just for that, for their appearance and to feel good about themselves.
Yes, so reconstruction really is not a medical necessity.
Okay.
It's a personal choice.
Right.
So when a woman has reconstruction of her breasts, it makes her feel whole again. It improves her femininity and her self-esteem and her confidence.
Right.
So some women obviously opt for have reconstruction, and some women don't want to have it, or they don't care, or if they're at an older age, then they say, well, I don't care how my breasts look or how I look, I just want this cancer out. In that case, they'll be flat, and then some will opt to just have a prosthesis in their bra or just stay flat. So it's a personal choice.
Okay.
So basically, we can do reconstruction at the time of the surgery, at the time of the mastectomy, which is known as immediate reconstruction.
Okay.
So after the breast is removed, we can place, say, an implant. That's one type of reconstruction. Or it can be delayed. So delayed means 6 months after the surgery, we can do the reconstruction.
Okay. That's, I honestly, all I could think of was I have a few cases in my inner circle who have gotten, mastectomies and then have had the reconstructive surgery, and it just helped them cope with the idea that they no longer have, their natural breasts. And I feel like a big part of recovery is your psychological state and your emotional state. And I feel like, as you said, some people are okay with it and they can, it doesn't really take a toll on them, but others, their appearance it does matter to them. And,
yes, of course.
It makes them feel good, and it makes them feel like they're back to normal, quote unquote. So,
right.
So I love that you mentioned that as well, and that you mentioned that it can be done immediately or it can be done 6 months down the line.
And also for the types of reconstruction, we can either replace an implant or there are things known as flaps where they use the body's own tissue, like we take tissue from the abdomen or the back.
Oh, really?
And it gives a more natural look and feel to the breast, more than an implant. However, it's more of a complex surgery and the recovery time is much longer. And maybe the complication rate could be a little bit higher with that kind of surgery.
Right. Is it because you're operating on different parts of the body at the same time?
Yeah, and it's a much longer surgery.
Right.
Yes.
Okay. We're going to divert a little. Not from the topic, but from women. Can men get breast cancer?
Yes, men can get breast cancer. Every 1 in 100 men can develop breast cancer.
Oh, wow. Okay, that's a shocking statistic. I didn't know that.
Yes, they can. And actually, men, when they do develop breast cancer, it tends to be a bit more aggressive.
Oh, really? Why is that?
We don't really know.
Okay, there isn't like a chemical or a scientific...
No.
Oh, wow.
So, yeah. It can be more aggressive.
That's
but yeah,
shocking.
men can get breast cancer. So if men feel a lump behind their nipple, or areola, it could be a cancer, but it could also be a normal condition known as gynecomastia, where they just have enlargement of their breast tissue due to physiologic factors or other factors.
Okay.
So not every lump is a cancer, but
Right.
they should be aware of it to get themselves checked either way.
Okay. And just back to we're just going to talk about the men for a little while, but are the causes the same as women? It's the same thing, lifestyle habits, the smoking,
Yes.
drinking, processed food, that kind of thing.
Plus genetic mutations. We haven't talked about that yet, but
Okay.
so about 10 to 15% of breast cancers could be due to a genetic mutation. So the most common mutations are what we call the BRCA or BRCA1 and 2 genes. Those are the commonest. There are other genes, of course, but those are the most common. So if a woman has a genetic mutation, like I said, it's important for all her family members to get checked as well. Because if there is a BRCA1 mutation, then there is an increased likelihood or increased lifetime risk to develop breast cancer or ovarian cancer, or both.
Okay.
So for the BRCA1 mutations, the chances are to develop breast cancer could be between 75 to 80% in her lifetime, and a 40% chance of developing ovarian cancer.
Wow.
And
Okay.
for a BRCA2 mutation, the chances are less. So breast cancer, 60 to 70% lifetime risk, and ovarian cancer, 20%.
And how do
lifetime risk.
people get tested for these mutations? Is it a blood test? How do you know you have that?
It's a blood test, or it could be done with saliva, where they check the DNA. And if they do have it, then they need genetic counseling.
Okay.
And we advise them to, at some point, consider having treatment for it. But initially, they need to have more regular screenings. So they need to have yearly MRIs, mammograms, ultrasounds, just to make sure that they haven't developed a cancer. And also for ovarian cancer, to have pelvic ultrasounds.
Right.
Some women opt to have their both breasts removed, which we call a prophylactic bilateral mastectomy. So because they're afraid that they will develop it down the road, they can have their breasts removed, again with immediate reconstruction.
Mm-hmm.
And women who have completed their family and they don't want any more children, they can opt to have their ovaries and fallopian tubes removed.
Right. Okay. So let's say there's a case that's been diagnosed with breast cancer, has completed the treatment, and is now cancer-free. I ask this question because I have, people within my circle who've been through this and have either, consistently visited their physician or have freaked out. They started freaking out afterwards because they're constantly thinking, is it back, or is it going to come back, or how am I going to know that it's back? So how often should a person get checked or perform these examinations if they've been previously diagnosed with breast cancer but have been treated already? The follow-ups, basically. Yeah.
Right. So in the first year, we like to follow them up every 3 months.
Okay.
And then in the second and third year, every 3 to 6 months.
Okay.
So basically, again, we'll do a physical exam, ultrasounds, mammograms, blood tests, just to make sure everything is okay.
Okay.
And then from 3 to 5 years, between 6 and 12 months, I would say.
Okay.
Right.
Okay. And it's not necessary for it to be more regular after the 3-year mark.
No, unless something is found. But if nothing is
Okay.
found, it doesn't need to be more regular. But obviously, even after the 5-year mark, they need to get checked every year.
Okay.
Every year, for as far as even 20 years.
Okay.
Right. Yes.
Okay. So what's your advice for women who are currently debating whether they should go get checked, but at the same time keep putting it off, and they want to look out for their health, but they keep putting it off? What's your advice?
I mean, I know women, or the women of today, they're very busy juggling their responsibilities,
Right.
and they tend to put it off. Either they're afraid or they're busy. or they forget. But
Yeah.
it's really important to make their health and their breast health a priority, because cancer does not pause.
Yes.
So they really need to go and get checked.
Yes.
And not be afraid, because honestly, if it's caught early, it's much easier to treat. And like I said, the treatment options are less aggressive than if it's caught late, when it's a big lump and it's spread to the lymph nodes or to the body. Then, that's a bit more difficult and more emotionally difficult for the patient.
Of course, yeah. I was just having a chat with friends yesterday. We were out for dinner, and I was telling them, I think there's so much awareness these days that we are aware that, going to a physician or a doctor should be a preventative measure rather than reactive. I should be going to check on my health rather than waiting until I'm in this ordeal and I have to deal with it. It's always good to get checked, get your blood tests in, get the mammograms, get your physical self-examine and the physical examinations. It's just we're at a time where it needs to be preventative rather than reactive. We need to constantly think about how I can always be on top of my health rather than waiting until it's too late or it's too serious or it's too severe. And then it's much harder to actually, treat it.
Exactly.
Treat whatever it is that you
Yes.
are diagnosed with.
And the thing is, these days, we're seeing more and more breast cancers in women in their 40s and some in their 30s. So,
wow.
yeah. And so I really encourage women from the age of 30 to go and get themselves checked with a physical exam by the clinician and an ultrasound.
Okay.
And from the age of 40, by, again, an exam and a mammogram.
A mammogram.
Yes.
Okay. Last question. I know you're busy, you're a doctor, you have patients, and this is the month, that's jam-packed. But what's your advice for women who may have been recently diagnosed and, are feeling kind of low or, going through the treatment and, are just going through a tough time? It is tough.
Yes, I mean, they may feel that they're alone, but they have to know that there have been millions of women that have walked in that path.
Right.
And so it's important to know that they can get through this and that they're stronger than this diagnosis. And they should reach out to loved ones, to friends, to family, to support groups. There are many support groups out there, and even to their healthcare clinician, because many healthcare professionals are there to guide them and give them the best advice. And so they should know that they are stronger than this and that they can get through it, to not figure everything out at once, but just to take it one day at a time and one step at a time, and try to be strong and know that it's for their own well-being and their health, and then make small celebrations as they go, down their
Yes.
treatment path.
Yes,
Yeah.
absolutely.